What's going on, everyone? Happy Saturday to everyone. Hopefully, everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you had to take a test for any other virus, hopefully you tested negative for that as well. If you did test positive, I hope you have no long COVID and no long-term issues. It is time now for the Saturday edition of the Pandemic Update for Saturday, April 13th, 2024. If you're new to my channel, this is where we do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. Let's face it, there's a lot of viruses out there, and we need someone who does a daily report telling you what's going on with COVID, measles, H5N1. Yes, that's been becoming an issue lately. Influenza, and all these different viruses. You need a place where you can come and get a daily report on that. That's what we do here. Want to stay informed? Subscribe to my channel down below. Like the content you see here? Give it a thumbs up. Want to help other people stay informed and in the know with what's going on? By all means, share these videos with anyone you know. And if you have a comment on anything you see here, or maybe something you want to say, leave a comment down below. All right, we do have some news stories that we're going to talk about today. Then we are going to do something that I think I promised I was going to do earlier in the week and did not do. It's long overdue. It's time again. We need to do an update on what are the symptoms of COVID right now. We're going to be using the CDC page, which is not always up to date, but it gives a general idea. And the reason why we're doing this today is because it's also allergy season. We're going to take a look at a list of allergy symptoms as well, and you'll see there are some relations to COVID, which is why you always should test anyhow. You shouldn't always just think, oh, well, it could be COVID. No, no, no. Pull out one of these old rapid tests and see what happens. You never know. You might come up positive. I know rapid tests are not the best, but you know what? Hey, even if you're feeling like your allergies is just worse than normal, you should test. All right, let's do the news first. In DuPage County in Illinois, this is in the Chicago area, they are reporting their first case of measles, not this year, not since last year, but yes, since 2009. A little bit of a tongue twister to say that because it's been so long since they've seen a measles case. It just goes to show you this is getting a little serious and it is still spreading. So, hey, remember yesterday I said maybe it's slowing down, and then I said, well, maybe we'll be right back at it again Saturday talking about measles. Here we are. There's another case. So, clearly, it is still spreading out there, and it is something that we need to be mindful of, and I think we'll continue to see cases. How big will this get? I don't know, but right now, for the time being, we are still seeing cases of measles right now, and it does not look like this case was linked to any new arrival shelters in Chicago, according to this article. I will tweet this out as I just found this story right before we started the update. All right, don't usually show the New York Post, but today we have to show the New York Post. Biden quietly revokes COVID executive order requiring masks in federal buildings, and this was reported on Friday. Washington, President Biden retracted several COVID-19 executive orders Friday, including one imposed on his first day in office to require people to wear masks in federal facilities. Now, I don't know if this was still being enforced in all federal buildings. I haven't been in a federal building lately, but hey, take a look here. It's being revoked. So, places like the White House, maybe Congress, any major federal building. Apparently, this has just been taken away. Yet again, we try and convince ourselves that this is all over with when it's not over, and here you go, this is not good. CDC, 20% of Mississippians have dealt with long COVID. So 20% of people in Mississippi are dealing with long COVID. And this article starts off with a minimizing statement. I would like to read that statement. Jackson, Mississippi. WJTV, even though the COVID-19 pandemic has largely dissipated, the virus's impact has lingered for many Mississippians. Hello, it hasn't dissipated, and it's lingered for the majority of states. Who remembers just the other day reported over 2,000 deaths so far this year in the state of Florida? Does that to you sound like a pandemic that has dissipated or ended? No, it does not. Let's read a little more, shall we? According to U.S. Census Bureau data cited by the Centers for Disease Control and Prevention, CDC, more than 20% of Mississippi's adults have experienced a phenomenon known as long COVID. The Magnolia state has the seventh highest share of its adult population overall that has ever experienced long COVID nationally. Roughly 39% of Mississippi adults who have had COVID 19 have had long COVID, the fourth highest rate in the U.S. Yes, the fourth highest rate. The state with the most long COVID, or at least when we last checked, we did several reports on this, would be Oklahoma. Of course, that could have changed, but I don't think it has. Oklahoma is they're not doing too good on the long COVID front. All right, let's go internationally for a second. Italy, COVID infections in Italy increased by 28% in the last week, from April 4th to April 10th. New cases 646. That's up 27.9%. Reinfections 41%. Deaths 15. That's actually down by 28.6%. That's good to see. The positivity rate is unchanged at 0.5%. Hospitalized 727, that's down by 0.6%. In the ICU in Italy, 21, that's down by 4.5%. Alrighty now, let's take a look at this. Virginia Tech researchers developing portable COVID test. Yes, what's that you say? Yes, they are developing a test that you might even be able to walk into a crowded store, restaurant, or even a movie theater and be able to detect if there is COVID-19 in the air. Apparently, what they are trying to do is develop some sort of a test where you'll be able to walk in a room and you'll be able to test the air, and within 15 minutes, just like we have on these rapid tests, you will be able to detect is there COVID in the air and assess your risk level. Now, they don't mention this in the article, and they should. They should say that when this is out, you should enter the room masked. And you know what? Let's be honest. Even if they do develop this test, and let's just say it's effective and works, you should still continue to mask in crowded spaces. And don't write down there, don't put those comments down there telling me that, oh, you sheep, you still believe in masks, they don't do nothing, blah, blah, blah. Yes, they do work. We're not sheep. The ones who are sheep are the ones who try to argue the fact that they work. The ones that try to argue say, oh, no, they don't work. You're the one that's wrong. They do work. There's plenty of studies at this point that state masks do work. Yes, I know there's other studies out there that say otherwise, but let's face it, masking works. Okay, moving on now. Let's talk about symptoms of allergies. Then we'll talk about symptoms of COVID. So allergy season, it's upon us. It's spring. One of the things that you can have happen is itchy, watery eyes, itchy nose, sneezing, runny nose, rashes, hives, stomach cramps, vomiting, diarrhea, bloating, swelling, redness, pain, tongue swelling, cough, throat closing, wheezing, wheezing, a whistling sound when you breathe, chest tightness and losing your breath, feeling faint, lightheaded, or blackening out, and a sense of impending doom. Yes, these are all some of the symptoms. But let's see here. Several of these symptoms I just mentioned that are allergies also show up on a CDC list of long COVID. Fever or chills. Cough. Hey, we just mentioned cough. Shortness of breath or difficulty breathing. Just mentioned that. Fatigue, muscle or body aches. Headaches. Hey, allergies can cause headaches too, and I know I did not see that on the list. Did we read that? Doesn't matter. Headaches. They can cause allergies as well. I've had that with allergies. New loss of sense of taste or smell. Sore throat. Sore throat, something you can have with allergies. Congestion or runny nose. We just mentioned that as well. We also mentioned nauseous or vomiting. We also mentioned diarrhea. Hey, that's symptoms of COVID and allergies. Again, see where I'm coming from here? See why I'm telling you, hey, you need to also test for COVID if your allergies are worse than usual. But it does come to a point in time where you need to seek medical attention for your symptoms. Trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay gray, pale gray or blue colored skin, lips, or even nail beds. Yes, it can happen. So you need to know what the difference is between COVID and allergies, and there's a lot of things that can be the same. And they also have a page down here about the difference between flu and COVID-19. Flu can even have some similar symptoms as well. It's really a reason why I think here in the United States we don't have it. They have it in other countries. The multi-virus tests, ones that can detect HMPV, flu, maybe Mpox, COVID-19. All these different viruses can be detected on one test, but we don't have access to that here in the United States. It is totally ridiculous. EMS incidents on Friday in Philadelphia, 739 incidents. You may be wondering, oh, why is he just showing Philadelphia? Why is he not showing anywhere else? Not really many other places in the United States that we can show you active EMS call volume, or like this, active calls. Here's active calls in the suburbs of Philadelphia, the surrounding counties just outside of the city. And you can see here, there are a few calls in Montgomery County right now. 9 active calls, that's less than what we have been seeing lately. I do see respiratory emergency, nauseous vomiting, cardiac emergency, head injuries, an accident, that's not good. Seizures, so yes, there are some things going on there. In Chester County right now, let me refresh this. Non-emergency hospital transfer, maybe that's not a good thing. Fall, lift assist, emotional disorder, unconscious person, back pain, falls, and EMS standby at this time. No update out of Walgreens this week. Yet again, we'll refresh. We'll take a look. We'll see. Maybe some chance there is. Nope, nothing from Walgreens this week. Wastewater. We'll take a look at wastewater tomorrow. Tomorrow will be our weekly wastewater bonanza, where we do go pretty much all around the country, taking a look at various different wastewater levels. But I do want to show you this. We're back to high levels of wastewater in Tennessee and high levels in Missouri. So that is something that we have to keep an eye on. Taking a look at hospital capacity in the United States. Inpatient bed usage. 74.8% of all patient beds are being used in the United States. 1% for COVID, 0.6% for influenza. ICU beds at this time, 69.9%. COVID-19 makes up 1% of that, and 0.7% is for influenza. I do want to take a look at a few states. First off, Massachusetts. Yeah, look at this. The capacity problem continues to get worse in Massachusetts. 81.9% of all patient beds are being used, and this is for ICU usage. 1.2% for COVID, 1.2% for influenza, and here's regular inpatient bed usage. Yeah, that got a little worse this week as well. 86.5% of all beds are being used, 0.8% for COVID-19, 1% for influenza, and I've been reading some tweets about hospital issues in eastern Massachusetts where people are saying it's the busiest they have ever seen them in all the years that they have been in Massachusetts. So that is not a good thing. Let's be fair now. Let's go somewhere else in the United States that's not in the Northeast. How about Montana? We haven't looked at Montana in a while. Inpatient bed usage in Montana, 61.3%. COVID-19, 0.6%. Influenza makes up 0.4% of that. How about the ICU situation there? And you're doing really well. Only 49.3% of ICU beds are being used. COVID-19 makes up a 0.5%, and influenza 0.4% of that. And now let's continue on to another state, somewhere else in the United States, and let's go out to New Mexico now. What is going on there? Your ICU usage, look at this. Not too bad. 55.3% being used, 0.3% for COVID-19, 0.7% for influenza. And when we take a look at inpatient bed usage, that's a bit higher. 77.1% being used. COVID-19 makes up 1% of that, 0.6% for influenza. And finally, how about we come down to somewhere on the West Coast. Let's see here. All right, Washington State. Let's see what's going on there. Washington inpatient bed usage. Oh, this is not good. 85.1%. 1.1% for COVID-19. 0.4% is for influenza. How about ICU usage? I hope that's better. It is 78.8%. And 0.8% of that is for COVID, 0.2% for influenza. So Washington, you're using quite a bit of your capacity at this time. And let's see here. Now, if we don't want to go anywhere, actually we do. I do want to check District of Columbia just for a second. 0.9% of all ICU usage is for COVID, 1.3% for influenza. Total usage is 75.4%. And let's go to inpatient bed usage. That is at 77.4%. and 0.9% for COVID, 0.8% for influenza. All right, moving on. Deaths in the past week, down 8.3% for COVID. Taking a look at what is going on with hospital admissions, 7,318. ICU beds occupied the past week. It looks like there may be a 1% increase. Or no, 0.1% decrease. I don't know what this middle number is actually referring to. Moving on here, we take a look at epidemic status. It's likely growing in Massachusetts and in Connecticut at this time for COVID, and it is likely growing for flu in Ohio, New York State, and Virginia at this time. The latest variants in the United States, again, we're starting to enter JN.1 soup, and the offshoots of JN.1. JN.1 is 83.7% of the COVID cases. JN.1.13 is 9.1%. JN.1.18 is 2.5%. JN.1.16 is 2.4%. Should we start to get more of these variants that pop up, we may have to go back doing region by region updates, but for now, I don't think we're going to be doing that for some time. Number one, I don't really have enough time to go out and do an extra video just for that, so we won't go that route, and not as many regions are reporting. Taking a look at the flu map, just one area is really in the high range at this time, and that is North Dakota, moderate for Nebraska, moderate for New Mexico, moderate for Michigan at this time, moderate for New Jersey, New York City, and Massachusetts at this time, also moderate in Iowa, and then you come into low and minimal states, which there's a lot of states that are in those categories at this point. All right, drum roll please. I hope we got something out of New Jersey today. Please, I hope New Jersey report. I would love to say New Jersey report. Look at that. New Jersey is back reporting again. But it's only 56 out of 70 hospitals. So we'll roll with that since we haven't done anything for New Jersey in several days. 205 hospitalizations, 5 people on a ventilator, 32 people in the ICU, discharges 27 at this time. New York State does not update on the weekends. Let's just double check to be sure. 591 cases, and they finished out on Friday with 507 people in the hospital and 60 people in the ICU. I'm confident next week's going to be the week New York State gets below 500 people in the hospital. Alrighty, folks, that does it for the Saturday edition of the Pandemic Update. We will have another Pandemic Update again on Sunday with a few news stories and our wastewater bonanza, where we take a look at wastewater sites all around the country for not just COVID, but all the other viruses as well. I will see you all again on Sunday. But before then, you got to do a couple things. First off, stay safe. Number two, hit that like button down below if you like this video. Give it a thumbs up. If you want to see more content like this, subscribe down below. Share these videos with anyone you know. And of course, if you have any comments on anything you saw today, something you did not see that should be reported on, or something you just want to say, leave a comment down below. It's true. The more interactions, comments, shares, likes, subscribers we get, the more they're going to push this content out on the YouTube algorithm. See you all again tomorrow. Till I see you then, stay safe, have a fantastic Saturday evening, and thanks for watching.